The recent revelation that the wealthiest 25% of Americans have life expectancies equal to the poorest 25% of Western Europeans is not just surprising, it's terrifying. It throws into sharp relief a profound crisis unfolding silently across the United States. This is not just about healthcare anymore. This is about a society that is structurally broken. In a country with the highest GDP in the world, people are dying younger, not because we lack resources, but because we've built a system that fails to protect even its most privileged citizens. Let's be clear, wealth has long been a buffer against poor health. Richer individuals tend to live longer, eat better, receive earlier diagnoses, and access the best treatments. But what happens when even that buffer starts to fail? The American healthcare system, despite being the most expensive in the world, delivers worse outcomes than nearly every other developed nation. People are spending more and getting less. But worse still, people are dying sooner, and the problem is not just among the poor or marginalized. It is creeping into every level of society, including the top. The fact that wealthy Americans are dying at the same rate as impoverished Europeans is a wake-up call. How is this possible? The answer is unsettling. Because life in the United States, despite the comforts of wealth, is increasingly toxic. Physically, mentally, socially, and environmentally. From constant stress and overwork to poor diet, environmental pollutants, mass shootings, social disintegration, and the spiraling cost of healthcare, being rich no longer guarantees safety. It only buys temporary insulation from a deeper rot. What this data tells us is that even if you do everything right in America, get an education, earn a high income, live in a nice neighborhood, see a doctor regularly, you are still subject to the same crumbling infrastructure, the same fractured society, the same systemic neglect that affects everyone else. You can't buy your way out of an unlivable culture. The system is eating itself, and the privileged are not immune. Even worse, this isn't a new trend. The United States has been on a downward slope for years. The COVID-19 pandemic merely exposed what was already falling apart. For over a decade, researchers like Dr. Stephen Wolfe have warned of declining life expectancy in America, even as the rest of the developed world continues to see improvements. That decline isn't due to one cause, it's a confluence of factors, all deeply rooted in American society. The glorification of individualism, the weakening of community structures, the devaluation of public health, the dominance of corporate interests in medicine, and the absence of a true social safety net. What makes this particularly disturbing is that the U.S. spends more on healthcare than any other nation. It has the technologies, the facilities, the specialists. Yet it consistently ranks near the bottom in outcomes like infant mortality, maternal deaths, preventable illnesses, and now, overall life expectancy. So, where is all that money going? To bureaucracy, profit, insurance loopholes, and administrative waste. Not to people's actual well-being. And the burden isn't distributed evenly. While the rich can still afford concierge care and private clinics, their advantage is shrinking. Meanwhile, millions of others live one emergency away from bankruptcy. There is a growing survivorship illusion in which the only people left to study are those who made it through, because so many at the bottom have already died, been excluded, or fallen through the cracks. That illusion paints a false picture of improvement, when in reality, it reflects mass early mortality. Let's not mince words. Living in America today is dangerous to your health. And that danger is increasing across the board. Gun violence is a daily reality, affecting every socioeconomic group. Mental illness is rising rapidly, especially among teens and young adults. Obesity, diabetes, and heart disease are rampant, even among the affluent. Environmental disasters, from wildfires to chemical spills, now strike neighborhoods once thought safe. And, even among the wealthy, many are turning to pills, alcohol, or burnout culture just to cope with daily life. What kind of society have we built, where even success can't protect you from dying young? This is no longer about fixing healthcare, it's about rethinking what we value. A nation that prioritizes profit over people, isolation over community, and consumption over care will inevitably face collapse. The warning signs are everywhere. And unless America confronts its systemic failures, starting with health inequity, environmental degradation, and the collapse of public trust, This decline will only accelerate. We are witnessing not just a health crisis, but a moral one. If even the richest among us are no longer safe, then we must ask, who is this system truly serving? The time for cosmetic fixes is over. Either the US transforms, or it continues down a path where life becomes shorter, more painful, and more uncertain for everyone.